This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Did you know that heart disease is the #1 killer of women, taking more lives than all cancers combined?
But many women don't know what's fact and what's fiction when it comes to heart health. Today, we test your heart IQ.
Casey Maru is used to being on the go. She's been all over the world, but one of her biggest accomplishments happened outside her doorstep, completing the New York City Marathon.
I did 489 miles worth of training.
What's even more impressive, she lost 110 pounds after having 3 heart attacks at age 40.
Heart attack number 1 was absolutely a wake-up call for me.
Like many women, Casey didn't know all the signs. Do you? True or false? Chest pain is the most common symptom of a heart attack. False. The first sign is often stomach ache, nausea, vomiting, jaw or shoulder pain, sweating, or fatigue. Question 2. What happens in pregnancy can affect your heart risk later.
Women who go through pregnancy, who have diabetes during pregnancy, who have preeclampsia, who have high blood pressures during pregnancy, have a dramatically increased risk of future stroke and heart attack events.
Question 3. All women should take a baby aspirin a day to prevent their risk. False. Studies show only those with a history of heart disease or other risk factors should. True or false? Your waistline matters more than your weight when it comes to heart risk.
Measure yourself. It's not a tailor's measurement. Measure your waistline around where the navel is. Okay, ideally, women should have less than 29 inches. If you're less than 33 or 34, probably okay.
Casey's advice is simple.
I try to laugh every day. I try to see friends.
And an American Heart Association survey found only 53% of women would call 911 if they believed they were having a heart attack.
Well, as we just learned, lifestyle changes are key to treating heart disease, but sometimes more complex medical intervention is necessary. One treatment involves placing a stent in a blocked artery to open it up.
And last month, the Guerreri Heart and Vascular Institute of Peninsula Regional Medical Center announced a clinical trial using a cutting-edge procedure that could replace the traditional stent. And here to tell us more about the procedure is Dr. Jeffrey Atherton, a cardiologist with PRMC. Nice to have you on the show today.
My pleasure, thanks.
Well, let's start off. This study is called Absorb 3. What is it?
Yes, Absorb 3 is a nationwide trial that's going to look at approximately 2,000 patients who need to have a severe blockage in their arteries of their heart and need to have a procedure using a stent-like device called a scaffold, an Absorb scaffold, that'll be placed in the artery much like a stent is placed when someone has a bad blockage in the artery.
Okay,
and we're doing them here in Salisbury.
And that's what this is, right?
Yes, that's
okay.
correct.
So what is this? What is it?
Well, the typical stents are made of a very thin metal material,
right?
And that device is implanted in the vessel and then is impressed into the tissues of the artery.
Okay.
But stays there, remains there.
Right.
This device is made of a material called polylactic acid, and this material is similar to dissolving sutures that you might get during surgery.
Right.
This material, once it's embedded in the wall of the artery, holds the artery open, delivers the medication just like a normal stent, but then over about 1.5 to 2 years, completely resorbs and dissolves in the wall of the artery,
really,
leaving the normal artery behind.
Wow. Now, could this replace the traditional stent?
It can in many situations. There are specific patients that would benefit from it. Some people can have this type of a stent depending on the shape of the artery and other factors. But we feel very strongly that it will replace many of the stent procedures in the future and will be actually a better procedure and better for the patient in the long run.
So it's a study on it now. Has this been used before?
It has been used in Europe over the past several years. First as trials in Europe, like in the United States right now, but it's presently commercially available in Europe as well. So people in Europe are having the stent placed on a regular basis. And it's a scaffold, actually.
And then so the advantages to this is that you don't have that stent or whatever in your vessel forever.
For the rest of your life. No, this thing will be there, do the wonderful healing process that needs to be done in the artery, and then it'll dissolve after the artery is healed up.
So is this good for anybody? Anybody, everybody?
Many patients could benefit from this. Not everyone is a candidate for the device, but if you have a severe blockage in the artery and you need a stent, this is an option. But talking with your cardiologist and him or her explaining to you whether you're a candidate for it would be the way to go.
And you say it takes about a year for it to resorb.
About a year and a half.
About a year and a half. During that time, you improve other things in your life?
Yes, then you work on lifestyle changes, and exercise, watching your diet, using the right medicines, and regular checkups with your physician.
All right.
Not a magic pill. You got to participate too.
You're right.
Dr. Jeffrey Atherton, thank you so much for
My
joining us
pleasure.
this afternoon. Great
Thank
information. Lots of stuff I didn't know.
And if you would like to learn more about the Absorb 3 clinical trial at PRMC, go to our website, delmarvalife.com, and click on the Show tab. Now, while we're talking health, a lot of it has to do with what we eat. Up next on Delmarva Life, we're going to learn more about the best foods we can eat to make sure our body gets all of the nutrients it needs.
And a little bit later on, many college students find themselves swimming in debt just to get through school. We're going to learn more on how to avoid a credit crunch. The Maru Life will be right back.